How to get tested after STI exposure. If you think you've been exposed to a sexually transmitted infection, acting quickly and correctly is key to protecting your health. First, understand that different STIs have different windows of time when tests can accurately detect them. For example, HIV can be detected as early as 10 days with a nucleic acid test, but sometimes it takes up to 90 days for antibody tests to show positive. Chlamydia and gonorrhea are bacterial infections that can often be identified within a few days to a week or two after exposure. Syphilis usually shows up within 1 to 3 weeks, especially if sores are present. Herpes testing is most reliable about 12 to 16 weeks after exposure, although symptoms might appear earlier. Trichomonas can be detected within a week to a month, and HPV testing in women is often done through pap smears, which can take weeks to months to reveal infection. Because each infection has its own timeline, it's best to consult a healthcare provider to determine the ideal time for testing based on your specific situation. Next, visit a qualified healthcare facility such as a clinic or your doctor's office for testing. Testing methods vary depending on the infection and the site of exposure. Blood tests are used for HIV, syphilis, herpes, and hepatitis. Urine samples are common for chlamydia and gonorrhea. Swabs from the throat, rectum, cervix, vagina, or urethra may be needed depending on your sexual practices and where you think you might have been exposed. Getting tested at the correct site ensures accurate results. Remember, many STIs do not cause symptoms initially, so even if you feel fine, testing is important, especially if you've had unprotected sex, multiple partners, or a partner diagnosed with an STI. If your initial test results are negative but your exposure was recent, your healthcare provider might recommend retesting after the window period to confirm. For example, HIV testing is often repeated at 3 months after exposure. Some bacterial infections like chlamydia or gonorrhea may require follow-up testing 2 to 3 months after treatment to make sure the infection has cleared. Always follow your provider's advice on retesting to ensure your health and prevent spreading infections to others. In some cases, post-exposure prophylaxis may be available, such as HIV PEP, which is a medication taken within a certain time frame after exposure to reduce the risk of infection. For bacterial STIs, antibiotics like doxycycline might be recommended in high-risk situations. It's essential to discuss these options with a healthcare professional promptly to determine what's appropriate for your situation. Lastly, remember that testing is confidential, and healthcare providers are there to support you. They can offer counseling, treatment options, and advice on how to prevent future infections. Early detection and treatment are vital for your health and for stopping the spread of STIs. Always seek personalized medical advice from a qualified healthcare professional, as individual circumstances can vary widely. If you suspect exposure, don't delay. Schedule your testing as soon as possible and follow through with any recommended retesting or treatment. Your health and peace of mind depend on it.